Well, the U.S. hit a grim milestone this week, topping more than 1 million deaths from COVID-19. And as much as we might hope the pandemic is behind us after more than 2 years, an ominous warning this week says otherwise. The Biden administration predicts 1 million new COVID cases this fall. Because of the threat of another fall surge, the CDC continues to encourage everyone to be up to date on vaccines. That means first and second boosters for all. But as of now, just a third of eligible Americans have received even a first booster shot. Now, I spoke earlier with Graham McKeen, the Assistant Director of Public and Environmental Health at Indiana University, about the rise in COVID-19 cases and what it could mean. Here's what he had to say. We've heard about the warning from the Biden administration about this fall, so clearly they don't think the pandemic is over. What's going on right now? Any updates?
Sure. I think that warning is some of the expected seasonal spread in the fall and winter. It's the waning immunity from infection and vaccines, and it's the continued evolution of the virus and its ability to escape immunity. And it is these new and ongoing subvariants of Omicron that are insanely infectious. We are climbing the ladder of infectiousness very quickly with each one. BA2.12.1, which is spreading very quickly now in the US, is 25% more contagious than BA2, which was 30% more contagious than BA1, the first Omicron, which was 4 times more contagious than Delta, and so on. So it's getting more fit. We even have BA4 and BA5 that will be here later this summer and are more contagious than these BA2s. Of course, we could get a new variant that could be more contagious or potentially more severe as well. And so that threat remains now and this fall.
The CDC is reporting a little over 70,000 new cases a day nationally this week. So how accurate is that with so many people that are testing at home?
Not very, because as you said, about 75% of all tests in the US are at-home tests. Those are not reported. They're not reportable in our public health system. So you don't see those numbers anywhere. And many don't get tested. So it's a gross underestimate, we're sure of. And the CDC reports on a bit of a lag to catch all those cases over that time. And we've had some days this week with over 100,000 cases confirmed already.
A growing number of COVID deaths are occurring in vaccinated people, but there's only a third of the population having received just at least one booster. So is that to be expected?
Yeah, I think it is. It is as immunity wanes over time with these specific vaccines. We have a virus that evolves, and we have pretty abysmal rates of booster uptake in the US. And that's, we're seeing that now. And honestly, the virus has evolved so much that we need to update vaccines to better prevent transmission with the Omicron sublineages. Problem is, we currently don't have the funding to do that. Production would need to start now if we were to have an ample supply for the fall or winter surge.
Last week, you began a Facebook post about COVID, writing, "If anyone still cares." So as someone, whose job is it to watch the numbers, how frustrating has all this been?
Sure, maybe that's a bit of snark, but it's incredibly frustrating. I'm not going to lie. We're going to hit 1 million confirmed deaths in the United States this week. 1 in 330 Americans have died of COVID-19 in just a little over 2 years, millions more disabled. And now just getting data on cases or trends is becoming difficult or impossible. So I understand, we are over it, but the virus clearly is not over us. It will not be eradicated. So we need to monitor. We need to continue to care for others and protect the most vulnerable and be willing to implement some of those, simple prevention measures when we have surges like we are now. Because wishing it away, ignoring it, or minimizing it isn't going to help and isn't going to stop it.
Graham, thank you so much.
Yeah, thank you, Joe.